Thank you for joining us for this COVID-19 live Town Hall Weekly Update, Safely Reopening Our Economy. My name is Erica, and I'll be your host tonight. We'll be taking as many of your questions as we can on this live event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from, and the next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. Or if you're watching online, you can send your question through the website. We would like to first set the stage for tonight's discussion. Douglas County began a phase-in reopening of its economy beginning April 27th, consistent with Governor Polis's statewide new safer-at-home orders that began that day. Since then, your Douglas County Commissioners have been working with the local business community and your Tri-County Health Department and many other community leaders on plans towards the goal to safely, responsibly, and lawfully reopen our economy. Tonight, your county commissioners will take your questions and provide you with updates on exactly what is being done. And speaking of safe, we encourage everyone to continue demonstrating the public health recommendations found in the state orders, including following social distancing guidelines, frequent hand washing, and especially if you're over the age of 65 or you have chronic health issues, staying at home as much as possible to avoid exposure to COVID-19. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Lincoln, along with Melissa Sager from Tri-County Health, are live via video and on the phone tonight. You can watch and listen at douglas.co.us/townhall. If you are just now joining us, to ask a question, you can press *3 on your phone and send your question through the website. So let's kick this off by going right to some questions for the commissioners. All right, let's go ahead and go to, they are coming all over here from on the phone and online. Our first question is going to be Desi. Desi is in Parker. Desi, go ahead and ask your question live.
Good evening, and thank you so much for having these calls and keeping us informed. We really appreciate it. Local business question. I operate 2 golf and country clubs in Parker, Colorado. Looking to see if the data suggests that you'll be coming out with further timelines for opportunities to enhance dining opportunities such as in dining, also pool activities, and if Douglas County has a timeline for pools, any of the activity-based scenarios and timelines that might be available for us to review and be prepared.
Hello, this is Commissioner Thomas, and I would be happy to talk about that question because all of us have been working on variances. So when the governor put the safer at home order in place for the Douglas County on April 27th, it has a piece in it that allows counties to ask for variances so we can get additional offices and businesses open once we file a suppression plan that's supported by our hospitals and our health department. We actually have our first variance plan in place at the state health department for Park Meadows Mall. After that, we have a series of other variances requested. Churches, restaurants, gyms, pools, playgrounds, spas, and we have those requests ready to go. So we're waiting to see how long it's going to take to get these variances. We certainly, Gary, would like to have everything open by the end of the month. Thank you for asking that question.
Wonderful, thank you. Our next question is for Melissa. It's an online question from Darlene, and she wants to know, are garage sales allowed?
Yeah, it's a great question, and we're getting it a lot recently. Garage sales fall into outdoor activities. It doesn't really fall into a traditional retailer setting, and we're discussing what outdoor activities can look like moving forward. These are conversations that we're having every day about what protections need to be in place before we can move into more increased outdoor activities. Outdoor activities are a bit safer than the indoor spaces because there's a lot more space outdoors, ventilation, and so we're looking at outdoor recreation and activities now. Currently, no, but we hope to have guidance available very soon.
Wonderful, thank you. We also have a lot of questions still coming in here by phone and online. So just a reminder that we are looking forward to answering all of these questions about safely reopening our businesses and economy as much as possible tonight. Again, to ask a question, you can press *3 on your phone or send your question through the website. And now we have an update from Commissioner Abe Layden about the COVID-19 Recovery Fund. Commissioner Layden, go ahead.
Thank you so much, Erica. And I think I might have been introduced as Abe Lincoln, which I'll take that any day of the week, being compared to Honest Abe. I think the goal of tonight is to be open, transparent, and just have a great conversation with the citizens that we work for. Again, we always say we work for you, not the other way around. But really some good news about the Douglas County Recovery Fund through the Douglas County Community Foundation. I want to thank our amazing Douglas County community for their generosity and support of the COVID-19 Recovery Fund. The Douglas County Community Foundation has already received applications from local organizations and has been able to distribute emergency funds to help serve those most in need in our community, but they had far more requests than they could possibly fund. But if you would like to continue to donate, you can visit dccf.org to support that recovery fund. The foundation will be distributing funds again in June, and local nonprofits can apply for the second cycle of the COVID-19 Recovery Fund, which is open now through May 28th. If your organization applied and did not receive a grant in the first cycle, you should have received an email with instructions on how to roll over your application to the second cycle. If there is still unmet COVID-19 impact and need, you would still like to be considered for a grant, you can do it that way. Organizations can visit dccf.org to learn more or apply.
Wonderful, thank you so much. And we are going to go ahead and take an online question here. And this is for you, Abe Layden. This is from Karen. Karen would like to ask, she says, I was relieved to see that there were consequences to C&C breakfast and Korean Kitchen's actions. Will people that attend these type of unlawful openings be held accountable? There are now potential carriers not taking responsibility.
You know, that's a fantastic question, and I'm really thankful that's being raised. I think it's important to our entire board to address that directly to our citizens, certainly a restaurant located here in Douglas County. You know, the Board of Douglas County Commissioners expresses our thanks to and support for citizens and businesses that are currently adhering to that safer at home order to both protect public health and begin restoring our economy. While our public health data continues to deliver evidence that reopening our economy is in our near future, we have to continue to partner in ways that preserves our ability to open our economy safely, responsibly, and lawfully. So with that in mind, various business leaders are working with us directly to request variances from the state health department to responsibly and thoughtfully reopen in partnership with our public health partners. And you heard Commissioner Thomas speak to that. There are a variety of industries, nonprofits, organizations that are looking to reopen thoughtfully. And as we continue to see that marginal rate of death and hospitalization decrease in Douglas County, we want to make sure that we're addressing the economic fallout as well, because it's a dual crisis. It's not just containing coronavirus, it's also addressing these secondary effects of jobless claims, mental health issues, domestic violence, and certainly some of these issues that are directing everyone in our community. So really thankful to be working directly with the business community and our experts at Tri-County Health to request those variances.
Wonderful, thank you. And now let's go to a live question. This will be for Melissa. This is Michael in Castle Rock. Michael, you're live. Go ahead and ask your question.
Yes, thank you very much for taking my question. If all goes well, when can we expect phase 2 to kick in so we can start having gatherings of 50 or less? And could I assume maybe that date would be at the end of May?
Thanks for the question, Michael. It's really challenging, and this is something that we talk about all the time when looking forward. And the difficulty is that the data to show what has happened since we've moved into the safer at home just isn't available yet. So we need to see what it looks like for us to gradually reopen, and we are very closely monitoring that data. That will impact what next steps look like, including larger gatherings. So if the numbers keep going down and we see that the safer at home has been successful and that we're able to operate, and then we increase those operations gradually, as long as the data is showing that it's safe to do so. It's tough to say the exact date for that, though.
Great, thank you. And as a reminder, if you're just joining us and if you want to ask a question, you can press *3 on your phone or send your question through the website. We will post a copy of this recording to our website in the next 24 hours. Also visit douglascovid19.org for county-specific COVID information provided by partners throughout the county. Okay, so last week we had a question about whether businesses can modify their facilities or buildings to accommodate social distancing requirements or other COVID-19 safety measures. Is there a way that you can give us an update on that? Commissioner Partridge, go ahead.
Certainly we can, Erica. Thank you for that. And with that question and with other businesses having conversation with us, we knew we would need to modify some of the building codes and accommodate what businesses are having to do with social distancing and other health measures. So just yesterday, your Board of County Commissioners passed a resolution to allow our planning director the ability to grant some waivers for certain zoning requirements, temporary zoning requirements, I may add, that would allow businesses to be more operational and in a timely manner. And a few examples of those, one would be to expand the seating in a patio area, may be necessary. Others would be convert a parking area to maybe a drive-through for curbside service, and then maybe even adding an external door to improve airflow.
Okay, wonderful. Thank you, Commissioner Partridge. All right, now let's go to a live question. We have Daniel. Daniel is in Castle Rock. Daniel, you're live. Go ahead and ask your question.
Good evening. Thank you for your time this evening, Commissioners. I want to ask you specifically, what data sets are we using to determine policy with regard to safer at home, social distancing, and the opening of certain businesses? My hunch is that you're using Tri-County Health Department's data along with the governor's policies, but I wanted to ask that question anyway just to be certain.
And I'd be, as Commissioner Partridge, I'd be happy to answer that. Thank you, Daniel. So you're correct. One of the few data points we can look at are the prevalence of COVID-19 positive test. With that, more testing will be occurring, therefore more tests will show positive. So you may think, well, that will throw off and skew. But one thing we've had a discussion with Tri-County on is they will also look at the severity of any of those positive tests, whether you'll have to be hospitalized or they have to be in ICU. So that is one metric we are looking at, no doubt. Some of the other key things are what we call unintended consequences. We all know it's certainly an impact to the economy. It's an impact to certain mental conditions for individuals. And we also know there's health conditions that some are not even addressing because some apprehension maybe to go to the hospital or to their doctor. So we know those are conditions. We know there are those who are starting to feel more comfortable to get out. So we take all these things under consideration, but you've hit it on the head. It's just not one thing we're looking at, but it is multiple things because we all feel this impact, and we certainly want to do everything we can to get us back to as near normal as possible.
And Melissa with Tri-County, do you have anything to add to that?
Yeah, sure. I'll just add that outside of the data points that Commissioner Partridge mentioned, we're also looking at the availability of testing and contact tracing and how much PPE we have, in addition to those traditional data points like how many people are in hospital beds, how many cases do we have. And then we're looking at non-traditional data like movement data. Maybe you've seen that. And it's looking at it as a full picture to see what's happening in our communities, what's available, should there be an uptick in cases. So it's a very broad range of information.
Great, thank you. And now many of you are asking questions still by phone and online regarding the option in the Safer at Home state order that allows counties to submit a variance application to the state to reopen specific operations under the order. Commissioner Thomas, I know there's been news coverage about the county's work with Tri-County Health, the City of Lone Tree, and the Park Meadows Mall for reopening variants, but what more can you share about this effort and others? Commissioner?
Thank you. Yes. Lone Tree was very helpful in working with us to submit the variance for Park Meadows Mall. And the reason that we submitted Park Meadows Mall first for the variance is that Pam Kelly at that facility had done an incredible plan to make sure people were safe. Tri-County Health toured the mall, and they were absolutely amazed with what Pam had put in place. So we thought, because this was such a great example, we chose to put that one through first. That was submitted yesterday with all of the final documents attached to it. So we're anxiously waiting to see how that one goes. But that included the county's variance plan. The suppression plan. And that plan explains how we're going to monitor the data, what we're going to monitor, if there is an uptick, how that will be addressed. If that is approved by the state health department, we are then going to file appendixes that will be for the churches, for gyms. Now, we also know that there's big gyms and there's small gyms that are more boutique. So we have different kinds of gyms that we're going to be requesting. And again, restaurants are one that we get lots of phone calls about. So as soon as we get the final answer on Park Meadows, we have many ready to go. Let me just add that Dr. Douglas and his staff at Tri-County have been very willing to listen to us and help and approve these plans as they go forward. So I'd like to thank them for their help and collaboration.
Great, thank you, Commissioner Thomas. And please stay with us. We're going to keep the conversation going. And again, we'll be on next week, Wednesday, May 20th at 5:30 p.m. for additional updates on our economic reopening and a specific focus on our older adults in Douglas County, talking about resources for older adults and what's important to keep you safe. Okay, we have a question right now live. David in Castle Rock. And David, you can go ahead and ask your question.
Thank you. So I heard you saying a little bit about the variances for certain businesses, and I'm asking specifically about restaurants. There's a lot of people in the service industry that are feeling this impact greater than most anybody, I think, that could be on this call. What about restaurants that have, rather expansive outdoor spaces where, in the past they could comfortably fit, 100, 200, 300 people? Will there be variances for those types of restaurants? I'm thinking of one, in Parker. I think of one in Franktown. I know there's a couple in Castle Rock as well. What's going to be done to hopefully help them open up sooner and get business back going again?
So thank you so much for that question. I think that's a really important one. And to my colleagues' earlier points, we are working directly with the restaurant industry right now to identify ways for them to phase open while still protecting public health. We know that the service industry is being significantly impacted, even though some measure of curbside service is available. So just to provide a bit of an update on a couple of fronts. One is we have had a conversation and a call with a restaurant working group representing all of the restaurants in Douglas County that Tri-County Health participated in, as well as the county and county staff. And the product of that conversation is to basically generate recommendations in a variance application for that specific industry that, again, both reflects best practices for public health, but allows the service industry and the restaurant industry to really survive what is a potential economic collapse if we don't act rapidly. So again, to Commissioner Partridge's point, this Board of County Commissioners I'm really proud of, because we have just recently, as yesterday, passed a resolution to allow the many of our property owners within Douglas County to make modifications in light of COVID-19 without a bureaucratic process, provided they're meeting certain standards. So it's much more streamlined for outdoor patios to be modified to make adjustments for COVID-19.
Wonderful, thank you. And now let's go to an online question. This is from Mark. He wants to know, why is COVID-19 testing important as we look at safely reopening and getting back to normal? Let's hear from Commissioner Layden and Melissa Sager of Tri-County Health about that. Again, Commissioner, go ahead and start on that.
Sure. Thank you, Erica. So testing is part of a multi-pronged approach to slow the spread of COVID-19. In Colorado, and certainly every county is expected to do its part to increase the number of individuals who have been tested statewide. So to help you know what resources are available in Douglas County to obtain a viral test, that's going to tell you if you have a current infection. So we're working with 5 different providers in the county who tell us that they have the capacity to support widespread testing. And that is AFC Urgent Care in Castle Rock, Care Now Urgent Care in Parker, Castle Pines Urgent Care and Family Practice, On Point Urgent Care with locations in Highlands Ranch, Lone Tree, and Centennial, DTC. Melissa, is there any more that you'd like to add?
Yeah, I'd love to. I'll just add that a bit more information on why testing is important. Testing tells us where the virus is, where it's going, who's had it. It allows us to quickly identify cases, provide quick treatment, and immediate isolation to prevent the spread. So the more we can test, the more we can identify where it is and isolate those cases.
Wonderful. Thank you, Commissioner Layden and Ms. Sager. Now we have an update from Melissa Sager from Tri-County Health Department. Ms. Sager, we look forward to hearing more from you. Go ahead.
Thank you, and I'll just take this opportunity to thank you all again for having me. This is such a great opportunity to connect with the residents of Douglas County and hear what information is not making its way to you so that we can address that moving forward. So I really appreciate the opportunity. I'm here to talk about businesses, as an increased number of businesses are opening in Douglas County under the Safer at Home. Tri-County Health Department would like to announce our newly formed Business Reopening Task Force. And we developed this task force to support businesses as they operationalize their COVID-19 plans for reopening. So all of those requirements under the Safer at Home order, from hand sanitizer at the door to opening your windows to increase ventilation, the task force is happy to chat through any of those requirements, anything that's unclear, and they'll be available over the coming weeks as businesses really operationalize these plans and put them into place to see what's working and what's not. They can be reached by both phone and email. The email address is covidbusinessrecovery@tchd.org, and the phone number is 720-713-6030, and I'll just say those one more time. COVID Business Recovery, all one word, at tchd.org, 720-713-6030. We really hope that you'll take advantage of that resource. We're here to help you and hopefully guide you through this new process.
Great, thank you. And Melissa, while we have you, Ken in Castle Rock has a question for you. Ken, you are live. Go ahead and ask your question.
Thanks. I was curious about what level of testing and contact tracing currently exists within the county, and then what level the county and the commissioners have established as being safe before entering phase 2 and entering phase 3.
Thanks for the question, Ken. I do not have those exact numbers in front of me. I will tell you that we are building our capacity to contact trace as we speak. I'd encourage folks, if you're interested in volunteering to be a contact tracer, to visit our website under careers. We're lining up volunteers to perform this contact tracing, and we're hoping to put together a very robust team to be able to do that more completely. I don't know if any of the commissioners have anything to add.
I may add to that that was very intuitive there, because the testing being done our concern is the amount of testing. We've just heard today that Skyridge Hospital is actually looking at doing as many as 50 tests a day. They're actually testing patients that are coming in for the elective surgeries. And we also know that the positives that we're seeing are coming in fairly low through the statistics. And Dr. Douglas makes a good point that we continue to see a descending curve for the cases that are occurring in Douglas County. So we're optimistic, and we're going to be very proactive in trying to get more and more open for the county.
So I know you've talked about transparency, but are there actually objective measures like a less than 10% positive rate or a specific number of tests that you want to know the county has the ability, or Tri-County has the ability to conduct as a minimum threshold before making those decisions to actually open up? I know you mentioned a suppression plan, so you must have some sort of a plan.
This is Melissa Sager again.
Oh, go ahead.
Go ahead, Commissioner. Sorry.
No, not at all. I'm sure you have quite a bit to add to that, because it's such an important question. And every day we are looking at the data and the metrics to make sure that there is really a suppression. And part of this variance process that we're working on with the state requires a suppression plan. And so we've established really a wonderful working relationship with the hospitals, with the public health experts who are daily monitoring to make sure that we're seeing a marginal rate of decrease over a 14-day period during Safer at Home on both hospitalizations and deaths. And the really great news that Commissioner Partridge touched on is that as testing has increased, we have not seen a spike or a surge in cases in Douglas County. In fact, quite the opposite. We're continuing to see a decline. So that's a really wonderful data point for us, and we're continuing to look at that daily.
Great, thank you. And we are just getting a lot of questions about gyms, pools, team sports. I'm wondering, Melissa, if you could just address this as a whole, since a lot of people seem to be interested in knowing when are those opening, are the pools opening, and what kind of decisions are being made.
Yeah, I touched on this earlier. It's a really tough one, again, just with the lack of data to show how we're faring under the Safer at Home in these early stages. That will inform next steps. The gyms, team sports, pools, these are all activities and facilities that have higher risk of spread due to commonly touched surfaces and close contact in all of these situations. And so we want to make sure that folks can engage in these activities safely. For gyms, allowing small group personal training, team sports, again, that small group personal training. For pools, we do expect, and team sports and gyms, we do expect additional guidance from the state in the coming days, but again, informed by that data that from the Safer at Home.
Great, thank you, Melissa. We're about halfway through our live town hall discussion about safely reopening our local economy. We still have lots of questions coming in. If your question is not answered tonight, you can visit douglas.co.us/ Citizen Connect to submit your question, and we will follow up with you directly. All right, let's go to our poll question number 1. We'd like to make sure you stay informed about what's happening in Douglas County. So we just want to say, if you would like to continue receiving information from the county, please press 1 on your phone right now. All right, let's go to our next question. This is Marie. Marie's in Littleton. Go ahead and ask your question, Marie, and this will go to Abe Layden.
Okay, hi. There hasn't been a lot of testing previously. I know that there's more testing now. But for people like myself and my husband who feel like we did have symptoms, we weren't able to get testing, I'm just wondering if we're going to be able to do antibody tests, because I would be more than happy to go out and start doing things back to normal and traveling and shopping and everything else if I knew if I had the antibodies or not.
And that question, Marie, sorry, will go to Dr. Douglas. Dr. Douglas, are you there?
Yes, I am. I just joined. Sorry, my phone wasn't muted, but I am here. So, Marie, I think your question was testing. Was it what's available, and can I get an antibody test? I'm sorry.
Right, it's more just an antibody test. Like my husband and I both felt like we had symptoms. We just couldn't get an actual COVID test. So we went through like all the symptoms and everything that were listed online from the CDC. All that stuff, fever, cough, and now we're both better, and we're just hoping, if we can get an antibody test, and if we can't get an antibody test, if we can both go and give blood to help those who, need the antibody still.
Yeah, so antibody testing is a fascinating area, and your questions are really great ones, albeit complicated. So what I would say is the following, is that there's a lot of places offering antibody tests right now. For example, National Jewish is doing it. Stride Community Health Clinic is doing it. There are places in Douglas County that are offering it. The problem with widespread use of antibody testing is that we don't really know how well any one particular test works. There's only about 5 that have been through what's called emergency use authorization by the FDA, which means there's a slim amount of data, and those are the best ones. The others are, frankly, we don't know just how good they are. I think there's a couple of ways that a good antibody test could help you. One is, gosh, I was really sick. I couldn't get tested. Did I have it? You could answer that question with some degree of imprecision. Could I help other people, which is a fantastic question. There are programs now trying to assess folks that have been sick to see whether their convalescent serum might be helpful. I can't tell you right off the bat where to go and get the tests that are doing that. I know Children's Hospital is doing screening for that. It might be a place to start. And then the final one is, am I immune? I was sick. I'm better. Did I have it? Am I okay? You're probably in better shape if you had it and it was real, but we don't truly know the meaning of antibody testing for immunity. So what I've probably said has confused you, because the whole field of antibody testing is confusing, but those are some of the basic tenets of it.
Wonderful. Thank you, Dr. Douglas. Next, we have Susan. This question is for Melissa. Susan, go ahead and ask your question live.
Thank you. Melissa, I'm asking a question from Parker, Colorado. First off, thank you for taking my question. And thank you to the county commissioners for all the things you've done for the last couple months, weeks, years, combating this whole situation. My question is kind of twofold, in that it sounds like one of the questions I have, or the question I had, is very much like Michael's question, talking about openings and pools and things like that. I think my question really focuses on the numbering of the number of 10 people that are individual, that can be based on who can be doing what in the environment. And I think in part, I'm fine with having people address how many people can be in a environment, which would right now, based on protocols, is 10. And is that going to change with Governor Polis's upcoming June 1st presentation? And I think that's it.
Yeah, that's a great question, and it does really closely align with the conversations that we've been having with the data and how we can open it up to more people. the 10-person limit in place again just to decrease the risk of spread and so to keep those groups smaller. We are closely monitoring that data and do anticipate increase in sizes of gatherings, but it'll be dependent on what that data shows in the coming weeks.
All right, let's go to Steve now in Castle Rock, and his question is for any of the commissioners. Steve, go ahead and ask your question.
Yes, my question deals with the restaurants and locally owned small businesses. Is any consideration being given to allowing the cities and communities to close down streets and or close down parking along the streets to allow the restaurants and the small businesses to expand their footprint out into the street area to allow for more seating or presentation of their product, to allow people so they don't necessarily have to go into a building to see the product or to have some food or something. And thank you for taking my question.
I'm going to ask Commissioner Thomas if she would answer.
Thank you, Commissioner Partridge. Yes, the commissioners have had this discussion, and we think it's very important to be able to help businesses get back on their feet as quickly as possible. So we have streamlined the process. It won't take you as long as it normally would. You can come at least to the county if you are in the county jurisdiction, unincorporated Douglas County, and you certainly can use sidewalks, parking areas to make things more accessible for your business. And if you are in the town of Castle Rock or Parker, you'll have to talk with that jurisdiction directly. But I know that they are as excited as we are to do whatever we can to help businesses get back on their feet as soon as the governor allows us and the state health department allow us to get more open. And we certainly think we should be able to do that because our numbers are very good in Douglas County.
Wonderful. Thank you, Commissioner. Now let's go to Janice. Janice has an online question, and this question is for Commissioner Layden. She says, as a practicing dental hygienist in Douglas County, we're having difficulty acquiring PPE. It's great to be open again, and we are finding back orders from our vendors to get surgical gowns. We require them to practice safely. Please direct us in this.
Yes, so we're really thrilled in Douglas County to say that PPE has certainly been increased in terms of availability and access to those critical forms of protective equipment. So we're thankful for that. And right now in Douglas County, we have a balance of about 15,110 N95 masks, 142,000 surgical masks, 3,333 face shields, 8,223 gowns, and 124,000 gloves. So please reach out if you are still not getting access to PPE. We want to make sure that you have that. And let me give you a specific website. So Energize Colorado has established an online marketplace for PPE and other supplies for businesses and nonprofits. And that is at energizecolorado.com /get supplies. So that should be readily available. Thank you for that question.
Okay, wonderful. Let's go ahead and go to the hand washing question. It looks like there's a hand washing question for Dr. Douglas in the online questions, and they just have a question about, do we keep washing our hands like this? What are anything updated as far as washing hands?
Thanks for the question. Hand washing is actually one of the things that has not changed since COVID started in terms of its advice. We've changed guidance or recommendations about should you wear masks on your face. There have been recommendations about should you try to get tested. That's all been confusing. Hand washing is a constant because respiratory droplets can be picked up transiently off surfaces like doorknobs or other commonly touched surfaces. And because if we happen to touch those, because we habitually touch our faces, frequent hand washing or the use of hand sanitizer, if you can't get to a place where you can wash it, is really It's not as good as a perfect vaccine, but it's a great line of defense. So we continue to urge that. And honestly, I think that sort of consistent hygiene is going to be with us throughout the COVID epidemic.
Great, thank you. And now we have a comment online from Doug Tisdall. He says, please note, he's with RTD. He says, please note that RTD is still providing public transit in Douglas County, even though on a reduced schedule. We will restore service as soon as we reasonably and safely can do so. We ask riders to wear masks to protect our operators and each other. Thanks. All right. Thank you to everyone who has joined us tonight. Thank you to Melissa, the Board of County Commissioners, and everyone else. You've asked so many thoughtful questions. We appreciate you taking the time out of your evening to be with us. We do have time for a few more questions, though, before we wrap up. Again, that's *3 if you would like to ask your question. All right. Next, we have Daniel. Daniel is in Castle Rock. Daniel, you can go ahead and ask your question live.
Hi, good evening. This is aimed more towards the doctor who is present, and I'm sorry I didn't catch your name, sir.
Dr. Douglas, John Douglas.
Hi, Dr. Douglas. Thank you for your time this evening. So my understanding is that positive cases for COVID-19 are including people who have symptoms of COVID-19 and are a close contact to someone who tested positive, but yet perhaps may not have actually gone for one of these tests that was previously mentioned. My question is this consistent practice with counting positive cases with other forms of disease, such as influenza, to use the hot button topic?
It is conventional in various disease situations to count confirmed and probable cases. We usually try to distinguish between them. If we have a foodborne outbreak at a restaurant and 3 people get sick with salmonella and another 10 ate the same thing and never got tested, then we would often characterize the latter 10 as probable cases. So I think it is important to distinguish it. And by the way, this business of categorizing COVID contacts who have compatible illness but didn't get tested as probable is still being worked out. It's being done somewhat variably. It's probably not as precise a part of the COVID count as we'd like, but the general notion of having confirmed versus probable is very widely used in infectious disease outbreaks.
Wonderful, thank you. Our next question is Joseph and is an online question. And Joseph's question will go to Melissa. He would like to know, what are the current guidelines for neighborhood gatherings outdoors?
That's a really great question, and Tri-County Health just recently put together guidance for this exact situation. These small gatherings, family, close personal friends of 10 or less, what can you be doing to protect yourself and others? A lot of it is what you've heard, washing your hands a lot, keeping safe distance, but some unique things in your backyard setting to hang fun signs, remind people, have some extra masks in case someone doesn't have one. Pick up the yard games because that's commonly touched and we don't want to be throwing bean bags back and forth to each other. So if you check out the Tri-County website and our COVID updates, you'll be able to find that guidance there.
Great, thank you. Our next question is an online question, Tish, and it is for Commissioner Thomas. She would like to know, there hasn't been much conversation about places of worship. If Walmart is basing their numbers on square footage, why can't churches do the same and still follow the 6 feet apart and masks, etc.?
Tish, we absolutely feel your pain. Commissioner Layden hosted a meeting this afternoon with pastors throughout the county, and it is one of the variance plans that we have in place. I understand that the Catholic Church has started having services with 10 people or less, and they're putting these groups of 10 in different sections. so they can get a few more people with different priests and different masses being said. So there are a few that are already started, but we are very anxious to get our churches open for the very reasons you've just said. I got an email from someone saying, what if we did communion in the plumbing aisle of Home Depot because there's so many people there? So we absolutely understand the confusion on this, and we are working with Tri-County Health and the State Health Department to get our churches, our houses of worship open as quickly as possible, because especially in the environment we're in today, people need to be able to go and talk to their God. So thank you.
Thank you. Next, we have Richard. Richard is actually an online question, and this is for Dr. Douglas. Richard wants to know, can you publish key medical indicators for the public to incentivize community compliance and see progress weekly? For example, hospitalizations and ICU beds.
Really good question, Richard. We do publish on our website information about the metrics of the cases, how many cases, how many hospitalizations, how many deaths. We've got a lot of information showing where the deaths happen in terms of the cities where the cases are occurring. We also have periodic updates about the ICU beds. And I'm going to have to check, because that's a really interesting question, because ICU beds have been an important parameter as to how regularly we update that and how publicly available that is. We certainly share that with our elected official colleagues, but I'm not honestly sure if we've got that available for the public. And I will take that back to the hopper, because I think it's a great suggestion.
Wonderful, thank you. Our next online question is Elisa Rice, and this is for Commissioner Partridge. She says, it seems like masks should be mandatory in stores and offices, but I've seen a lot of people not even wearing them. Is this not mandatory?
Elisa, your question is one that has been brought up, no doubt, locally, statewide, and nationally. And with the stay-at-home order, masks are recommended through the state order. In Douglas County, we, the commissioners, have had that discussion. We have made a decision to not make it mandatory in Douglas County. Although masks have shown effectiveness, there's some that feel they may not. But for us, we believe that should be a personal choice. And for those who aren't wearing masks, we hope they aren't suffering from any retaliation. But for those who are, we commend them. We realize there are areas of the state, even our own county, who make it a requirement. We honor that. We give them that as their choice. So it is not mandatory in Douglas County.
Got it. Thank you very much. And just a final reminder, if your question wasn't answered tonight, we encourage you to visit douglas.co.us/citizenconnect to submit your question, and we will be responsive. Please be sure to join us again next week, Wednesday, May 20th at 5:30 p.m. for additional updates on our economic reopening and a specific focus on our older adults in Douglas County, talking about resources for older adults and what's important to keep you safe. Before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. So let's hear from Douglas County Commissioner Abe Layden first. Abe, go ahead.
Thank you, Erica. And I really want to thank Tri-County Health and my colleagues, Commissioner Partridge and Commissioner Thomas. I can tell you firsthand, with the 10 to 12 hours of meetings and calls we're on every day, that my colleagues really deeply care about each of you. And I know we represent 370,000 citizens, but it is so important to them and to me as well to know that you are safe and well, and that we are moving towards a finish line. And when we realize this is a marathon, not a sprint, but I always say that when we link arms together, we can see that finish in sight. And you know what? Douglas County is the healthiest county in the country, and we have no interest in losing that designation. We know that's because of you, not because of us. You are well educated, you work really hard, and you drive our economy. So as we look at the numbers, we recognize and appreciate every case and certainly every death that's occurred. Every life is valuable. But the flip side is we also really want to reflect upon the 370,000 of you that are out there that really want to get back to normalcy, want to get back to your jobs in a way that is productive. So we're balancing that every day. And just know that we deeply care about you and we enjoy these conversations. So please join us next week.
Wonderful. Thank you, Commissioner Abe Layden. And now let's hear from Douglas County Commissioner Laura Thomas.
Thank you, Erica. From the questions we heard tonight, it's obvious that our citizens are frustrated and they want to go back to the way life was. And I'm grateful to those of you who have been following the regulations that the governor's office has in place for all of us. You have helped get the numbers down, and we are ready to get back to our lives. I think it's important that you all know how hard we have been working with staff. We have been writing suppression plans, letters. We've been talking with Dr. Douglas. On Monday, after the three commissioners had a conversation, we called in Dr. Douglas, very quickly got on the phone call with us and listened to us. So I just want you all to know that Dr. Douglas has been willing to listen and really understand as we tell him how frustrated you all are, that you are ready to go back to doing things in a safe way, and that we support your choices and your ability to take personal responsibility for your actions. So just know how hard we are pushing to get things back to a more livable way of life for all of us. And we'd like to thank all of you for being on the phone call tonight. And I'd like to say good night and God bless to all of you. Thank you.
And next, let's hear from Roger Partridge, our Douglas County Commissioner Board Chair.
Thank you, Erica. And I really want to thank my colleagues, Laura Thomas and A. Layden. It's what a privilege to serve with them, even in this challenge. So, and to the public, thank you for taking the interest. And we hope we are certainly answering your questions, giving you hope, because that's what it's going to take to get us where we are desiring to be. The cooperation we've had with Tri-County Health has been wonderful. We've been working with the state, and also know that we've worked with numerous other counties around the state. And we've had a little bit of mention of the other municipalities in Douglas County, but please know too, those elected officials and leaders in the municipalities have worked with us very closely in all the guidance. We've worked with individuals, getting their advice on how to proceed. We've worked with businesses, and our staffs are just phenomenal. So we know we can do more, but it does take a lot of effort on others. And if there's any advice we can give, I think it is for those who are presently not working is do as best you can to come up with what kind of plans you can proceed with, knowing there probably will be some restrictions. But make those plans now, because we know the sooner you have information for us, we know that you'll be ready to spring into action. And please know we're there for you, and please don't hesitate to reach out to our questions. Thank you, Erica. Thank you, listening audience, and thank you, Dr. Douglas and Melissa, for joining us.
On behalf of Douglas County and the Tri-County Health Department, thank you for sharing your evening with us. We hope you will join us again next week for the Safely Reopening Our Economy update, with a special section on resources for older adults and more. Be well, be blessed, and good night.